Centers for Disease Control reported that Lyme disease risk had risen by 320% over 2 decades. Since 2001, reported cases of Lyme disease have both grown and spread from the Northeast as far west as Wisconsin and Minnesota, with cases popping up across the country. Lyme disease is an infectious disease spread to humans when they're bitten by ticks, which are these small insects that feed off the blood of mammals. Once bitten, if the tick is not removed within 24 to 48 hours, the bacterial infection can set in. Now, diagnosing it can be difficult until major symptoms like fatigue, rashes, polyneuropathy, vertigo, and even mental health problems like psychosis start to show themselves. And while it can be treated with antibiotics, the symptoms often persist for years after treatment, something that has been contradicted by the CDC and many medical professionals. For years, doctors have claimed that those with persistent symptoms related to Lyme disease were hypochondriacs. But for those suffering with Lyme disease, their pain was real. And with between 288,000 and 300,000 people in the United States diagnosed with Lyme disease each year, it seems like it's time to take a closer look at prevention and treatment options. Joining us today to discuss the disease and more is Dr. Kent Holtorf, MD, who's the medical director of the Holtorf Medical Group, which specializes in bioidentical hormone replacement, fibromyalgia, CFS, thyroid disorders, and of course, Lyme disease. Welcome, Dr. Kent Holtorf. Thank you for joining us.
Hello, thank you for having me.
This is one of those fascinating discussions I want to get into, but first I want to ask you, what inspired you to specialize in Lyme disease, and specifically it seems diseases that are often kind of scoffed at by modern Western medicine professionals?
Like many others have gotten into this so-called controversial area, I was sick myself. And going through medical school was very fatigued. I got to the point where I don't think I could continue my career. Went to standard physicians, and I was very much a standard physician, only evidence-based, which I still am, but, was told that, hey, it's nothing, you're just stressed out, you're just depressed. I wasn't depressed, I couldn't function. And so basically, in trying to help myself, that's when I learned that so many others are suffering from similar conditions of all these chronic fatigue syndrome, fibromyalgia, which is now discovering many of those patients are chronic Lyme.
Wow.
It's interesting because the CDC readily admits that Lyme disease is spreading. They admit that it can cause a myriad of painful, debilitating symptoms, and yet they seem to be trying very hard to create the narrative that it can't present in people as a chronic illness. What is the difference between your sort of common Lyme disease patient and one who's suffering from chronic Lyme disease?
That's a very good question. It's interesting, why with all the studies coming out, and there's literally thousands of studies show that chronic Lyme exists, but everything just gets so politicized, and whether it's emotional debate, financial reasons, that they just don't want to admit that it exists, but the studies are overwhelming. And the problem is that Lyme is a very complex organism. It has more genes than most any other bacteria. And the physiology makes it very hard to treat and also very hard to diagnose. So acute Lyme person basically will go in, let's say they have a known tick bite, usually some flu-like feelings, and often, not often, but sometimes a bullseye rash, which is kind of the hallmark of the illness, but now we're finding that that typical bullseye rash is seen in less than 20% of people. So what happens, the acute Lyme patients can go in and get treated, and the thought is, even with those patients, that, okay, you treat it early, a couple weeks of antibiotics are good, but now studies are even showing with those patients, between 20 and 60% will never be the same after even a so-called successful treatment, because this bacteria evades the immune system so well.
That's incredible. Now, up until recently, there weren't a lot of alternative therapies even available for people suffering from this illness. First, why hasn't Big Pharma, paid attention to this market, and what legitimate alternatives are available for those those chronic sufferers?
That's a very good question. You look at the amount of funding that's going towards Lyme disease or even chronic, that even though it's 10 times more prevalent than so many other illnesses such as HIV, even breast cancer, and it gets a small percent of the funding, and who's going to do research on a condition that the standard infectious disease Society of America says doesn't exist? So it's very difficult to get long-term studies on chronic Lyme, even though, because they say it doesn't exist, but we can pick out, for instance, a chronic Lyme, a chronic fatigue syndrome, fibromyalgia person, which so many doctors still say, oh, we don't believe it, it's a made-up illness. We can pick it out in a blood test with not even checking for Lyme, just looking at the effects on the immune system. We can differentiate a chronic fatigue syndrome, fibromyalgia, chronic Lyme person, and the degree they're sick about 80% of the time.
Wow.
So saying this is a made-up illness just doesn't fit.
Is this something I found, because I have a close family member, one of my parents got Lyme disease and it took them years to figure out what was wrong. I had Graves' disease when I was younger, which led to hypothyroidism, also was misdiagnosed for years with the same thing. Is there something about endocrine issues, or what is it about those things that Western medicine just refuses? They want to make it, you're depressed, I was told I had an eating disorder, my father was just told he was, tired all the time. What do we have to do as patients to do something about that from our angle? What do we do?
That's a very good question, and I'll just explain a little bit of physiology. I think it will help explain. So what the basically Lyme bacteria does, as soon as it infects the body, it starts suppressing your intracellular immunity. So you have two sides to your immunity. You have Th1 and Th2. This gets stuff inside the cell, this gets stuff outside the cell. The Lyme will immediately suppress Th1 and the body will raise Th2, trying to kill it, but it can't get it once it's inside the cell because it suppressed this intracellular immunity. So when that happens, now you get significantly increased autoimmune disease. You get all these chronic illnesses, increased diabetes from the inflammation, and it all becomes a vicious cycle where you get sleep disorders, pituitary dysfunction, so your hormones are low. That causes mitochondrial dysfunction, so the cells have no energy, which then makes the immune system worse and then causes the bacteria to grow. So you see all these vicious cycles. And it's where you want to intervene on so many levels, and it's such a multi-system illness that doctors are overwhelmed. And this is what we do for a living, is treat these patients, and I can't treat it in the standard visit of 8 minutes. And so many doctors discount it because they don't want to take the time to treat it, and they're going to also have to learn about this new illness. So I think it allows them to sleep at night and say, hey, I'm not a bad doctor. This illness doesn't exist. So I think there's a lot of reasons why patients are just told they're depressed. Here's an antidepressant, go away.
Well, let me ask you this.
The doctor's not a bad doctor; it's a patient issue.
Yeah, let me ask you this: what are the best steps for not only treatment and prevention? Got about a little over about a minute and a half left. What can people do to prevent, and then what are some of the better treatments that somebody at home can do?
Yeah, with prevention, we're finding everyone all about ticks, but we're finding that it's transmitted also, probably sexually transmitted, mosquitoes, fleas, again, ticks, mites, so many different means. But we're finding that one is getting a diagnosis. The standard tests are missing 80% of people who have chronic Lyme. And we're finding, antibiotics certainly have their place, but we're finding immune modulatory therapies, such we're finding peptide therapies are revolutionizing this treatment, umbilical cord stem cells, and things that direct at the immune system we're finding are becoming core treatments for this, and not just looking at trying to kill the infection, because the body can't clear it with a low immune system.
Well, Dr. Ken Holtorf, I got to say thank you so much for the work that you're doing and coming on today. It definitely was a fascinating conversation, and keep up the good work.
Great. Thank you so much.
Thank you.